All right, good evening. All right, so today our lesson is going to be over the role of medicine. Can anybody tell me what medicine is? Not drugs. Tell me what you think what medicine is. What's the purpose of medicine?
Like to help people and stuff, like help people like get through stuff.
You got medicine that help you mood enhancers. What other kind of drugs are there? What other medicines are there? If you got a headache, you're gonna take what?
Ibuprofen or Tylenol.
All right, that's to help you what? Reduce a headache, right? All right. So just to open up. All right. Recall the last three medicines that you have taken. What's the purpose? What's the purpose while you're taking them, and did they work for you? So let's think about the last. You gotta say three. Let's think about the last medicine that you took, and what was the purpose of it, and did it help you? So anybody, give me one. Ibuprofen. Why do you take the ibuprofen? Your arm was hurting. Did it help you?
No.
It didn't. It didn't help the pains subside any. Okay. So she said her ibuprofen didn't work. Somebody else.
Melatonin.
Melatonin.
Mm-hmm.
Okay. What you took the melatonin for?
Go to sleep.
Did it help you go to sleep?
Yep.
Okay. All right. All right. So I'm gonna go through some slogans. I'm gonna see if y'all pay attention to medicine. All right. The first one. Plop, plop, fizz, fizz. Oh, what a relief it is. Can anybody tell me what that is?
It goes in like
It's
a
that
drink,
thing. It's like an Alka-Seltzer or something.
Yeah.
Alka-Seltzer.
Mm-hmm.
All day long, all day strong.
That's the energy.
Ain't that the thing with the little green man on it? The little fat green man?
No.
Okay.
It's a medicine.
Oh, it's not an energy drink.
It's a medicine.
Oh, okay.
What kind of medicine though? No, it's your heart.
You take it.
Injection.
Take it for your head. I'll give you a clue. You take it for your head. And it begins with a T. Tylenol.
I said that is
Pepto-Bismol.
All right. Everybody should get this one.
Pepto-Bismol.
Nighttime, sniffing, sneezing, cough, achy, fever, best sleep ever. Got cold medicine. NyQuil. And the other one y'all should get nausea, heartburn, indigestion, upset stomach relief. Pepto-Bismol. All right. All right, just trying to give a little fun fact. All right, so the role of medicine. Medicines are classified based on how they work in your body. Medicines, drugs that use to treat or prevent disease and other conditions. So people that may have cancer, they have a chemo pill. So that's something that they may take to help them, handle the cancer, help fight that cancer. So medicines basically they help to treat or prevent disease. All right. Then we talk about the drugs. Drugs are substances other than food that change the structure and the function of the body or mind. So could you think of any drugs that may change either the structure?
Acid.
Who?
Acid.
Acid?
cocaine.
Coke.
Heroin.
Heroin?
Yep.
Cocaine? Okay.
All them things.
All right, so what's the difference between a drug and a medicine?
A drug is something that you may be able to get off the streets and like medicines. Never mind.
Well, medicine is
Come on.
medicine to help your immune system.
Okay.
Medicine can be prescribed and drugs are something you get off.
But what's the main difference?
Medicines are to like benefit your system, and then
And drugs
drugs
can-
just take down your system.
Drugs that cause the harm, right?
Yep.
All right.
They'll give you disease. Yeah. Especially when
All right, so medicine treats or prevent illnesses. The four classifications: preventive disease, fight pathogens, relieve pain, manage chronic conditions. Can anybody tell me a preventive disease? Who? Say it.
I was gonna say STD.
They are medicines for STDs. There's medicine for herpes, gonorrhea, HIV, AIDS.
HPV.
Yeah, so HPV.
Yeah, HPV.
That's a common one now. You know. What about to fight pathogens?
Like colds and stuff.
Is that what that is?
Like blood, doing like bloodborne pathogens like
Like
hepatitis.
AIDS.
You ever heard of hepatitis? So that'd be like to fight a pathogen. All right, what about relieving pain? I know y'all should know this one.
Headache,
Concussion.
What medicine?
Ibuprofen, Tylenol.
What medicine would a doctor prescribe you?
Oh.
Who?
Percocet.
Percocet.
Oh wow. Oh yeah.
Like when you're going into surgery and stuff like that.
What else? EpiPen?
I thought that was for like allergies.
EpiPen can be, but it won't be for pain relief. I'm talking about for pain relief.
What's that is? It's not a drug. Well, they give it to you while you're there, like
What is it?
the anesthesia to numb you, relieving pain.
Okay. Well, yeah, they wouldn't provide you anesthesia for pain relief.
Right.
They knock you out if you in enough pain.
But it's to help put you to sleep to go have surgery. So what about, have y'all ever heard of like Vicodin?
No.
I got a question. Is Adderall prescribed?
Adderall is prescribed. What about Loratab? Never heard of Loratab?
I probably heard of it.
All right. What about managing chronic conditions?
Chronic condition. What is-
Like an injury?
Chronic pain.
Oh, so like
So like cancer.
joints or like joints, like
They do have marijuana for medical to help manage chronic pain.
You should have said it.
But you also said the chemo pills earlier.
Oh yeah.
So that would be something. All right. Disease prevention. Vaccines or preparations that prevent a person from contracting a specific disease. What we dealing with now?
Corona, COVID-19,
COVID-19. And they came out with what?
the vaccinations.
A vaccine, right? They
Yeah,
came out with a
it's
vaccine. They came out with
A booster
a
shot.
booster shot. And they coming out with another booster shot. So that vaccine, most vaccines, we've been getting vaccines since you were a little kid, since you was a baby. Most of you, in order to get into school, you have to provide the school with what?
Which your medical history.
Your medical history that has all the vaccines that you've taken. So you got like pneumonia vaccine. You got anybody take flu shot? You ever? Got the flu shot. That's a vaccine.
HPV shots.
Who?
HPV.
shots.
HPV. They just started that one. And so most time when you was a baby, you would get your shots at 2 months, 6 months, and then 1 year old. That's how.
When you're a baby, like at 2 months, do you like why do they have to get the shot?
Because when you're a baby, your immune system is just blank. It really can't fight against anything. So if you're around somebody, just say like now, a common thing that they have that's going around is what's the doggone disease? RSV. It's a respiratory deal. It's similar to like having a souped up cold. And so it attacks your respiratory system, and it's harsh on babies. So they have different vaccines that they give the baby to protect them against coming in contact with like people that may have RSV. That may be like an upper respiratory infection. So that's what that is in combination with. All right. And so the vaccine contains weakened or dead pathogens that cause the disease. When injected into the body, the vaccine produces antibodies that fight the pathogens. Your body also produces memory cells that recall how to make these antibodies. So if you had COVID-19, what did they tell you? For how many days are you immune?
Yeah.
For 90 days because you got what?
Cool.
Antibodies in your body. So, whereas a person that had COVID got antibodies, I took the vaccine, so they injected the actual virus into my body so that my cell membrane can remember, oh, this is, if I come in contact with this virus again, I know how to fight against it. And it built up an immunity to that virus because I got the live virus put into me. All right. So not all viruses are dead. Some viruses are live. All right. To fight pathogens, antibodies, class of drugs that destroy disease-causing microorganisms called bacteria. When antibodies were first introduced, they were considered a miracle drug because they saved many lives. So, like we talked about a minute ago, when you get those antibodies in your body, it's gonna help destroy the bacteria. So, a lot of times we have all kind of bacteria that's getting on our nails, our hands. That's why they tell you if you come in contact with somebody with COVID, make sure you wash your hands and all those things so you don't get those bad bacteria. Are there such thing as good bacteria?
Well, yeah.
There are some good bacteria. All right. Relieving pain. Most commonly used medicine are pain relievers or angelastics. So angelastics are ranged from relative mild medicines such as aspirin to strong narcotics such as opioids-based morphine and codeine. So, have y'all ever heard of morphine?
It helps with pain. I think.
It helps with pain. Who do they most times give morphine to?
Mm.
You mean like what age range?
No, like people, and what illnesses are they dealing with?
I know they give it to people that have bone cancer. Sometimes they give them morphine.
Like people that have cancer, they give them morphine because it's a little stronger than a regular opioid-based drug. And so, think about it. Y'all ever heard of somebody getting put on hospice?
Yeah.
I mean, they done everything they can do for you, and they can't do anything else. So they try to make you comfortable as possible, and they sit there and they pump you with morphine to help ease the pain. A lot of cancer victims, cancer patients, are placed on morphine. Mm-hmm. But the opioid-based drugs are like Percocets, Xanax, uh, heroin.
They prescribe heroin?
They don't prescribe it, but some pills they have some pills that are close in similarity to what heroin would give you. So addiction to pain relievers. How many times have you heard of people like get hooked on pain medicine? It happens a lot, right? Because they like that feeling. I like that feeling that Percocet give me. You know.
Don't it just like put you to sleep type stuff? Or it just like gets you like high?
It gets you high, make you feel numb. But a lot of times people like that feeling and they trying to chase that high. So guess what? Where you used to take maybe 2 or 3, now you may be taking 5 or 6. In this parish, they have a what epidemic going on?
What?
What type of epidemic do they have going on in this community? Well, in this parish?
Mm-hmm.
What? The youth coalition. If you're in the youth coalition, you should know.
Oh, innovate.
What did it start with? Opium based?
Opioid.
Okay.
Got a high opioid. A lot of people are on a lot of pain medicine that's not prescribed for them. They like that feeling that they get, and they try to chase that high. And so And Washington Parish is probably one of the highest parishes in the state of Louisiana that has an opioid addiction going on. Not saying that we the only parish, but it's just high in numbers. Also, New Orleans.
New Orleans.
New Orleans have one because they have a high influx of fentanyl, heroin, all those things. Those are all opioids, and a lot of people are addicted to them. All right. Managing chronic pain, chronic conditions. I'm sorry. These medicines maintain or restore health or offer people chronic disease a higher level of wellness. Allergy medicines, body regulating medicines, insulin and cardio, antidepressants, cancer treatments. It's all the people that and all the medicines that they have. So how many of y'all have allergies in here? What's the medicine you take for your allergies?
What's the
Who? Zyrtec. Yeah.
them things that you put up your nose?
Claritin.
Yeah.
All right. What about, how many of y'all know people that take insulin?
Isn't that what?
People that take insulin, what are they?
Yeah.
Diabetics. It helps regulate their number because their body don't produce enough insulin to break down the sugars. What about, have you ever heard of somebody taking antidepressants?
Antidepressants, like, I really don't get it because, like, they really, like, give you suicidal thoughts. They give you suicidal thoughts worse than you already do have.
Mm-hmm.
That's why I don't understand why they call antidepressants. They don't do nothing to make you more depressed.
But that's just after they wear off.
Like, what she say?
It says after the medicine wear off.
It's supposed to wear off in 2 hours.
Oh no, maybe it's not strong enough.
I don't know.
I don't know. But they have antidepressant, and then you talk about cancer treatment patients. They deal with chemo and different things of that nature. All right. These are the ways you can take medicine. Or taken by mouth, topical, applied to the skin, inhale, like delivered in a mist or a powder, and injected. So, oral medicine, what medicines you would take oral?
Tylenol, ibuprofen,
Pills.
anything solid.
What about topical?
Like gel or like stuff for like you rub
Like a
on.
cream, a lotion, anything of that nature.
Attention teachers and students, may I have your attention please? There will be no tutoring today or the remainder of this month. We will resume after-school tutoring after the Mardi Gras holidays. Thank you.
All right. Inhale.
Inhaler.
So what you,
Inhaler.
like an asthma pump? What else?
You know how you gotta shoot up your things up your nose, like if you stopped up.
Yeah.
A breathing treatment.
For breathing treatment?
Yeah.
Or them little things that you gotta sleep with and stuff like that.
What? What are the things you gotta sleep with?
Like, you know, like people can't breathe when they sleep.
Talking about like the breathe right strip that you put over your nose? Yeah. All right. What about injected?
Shots.
Like HPV shots, like say for instance you're allergic to something like that. Yeah. I
Or
don't
like
think you're allergic to it though.
The EpiPen. What about insulin?
Oh yeah.
Oh yeah.
You inject insulin. What else you can inject?
Drugs.
No. Besides drugs. No, what other medicines are injected? What the most you young ladies on? Birth control.
I don't know.
They can give you a birth control shot. You can get a birth control pill. They can put the patch in your arm.
What's that fluid that they give you like a injection?
It's like an implant. That's what they call it. An
They
implant.
got an implant that go in.
It goes in your arm.
In your arm.
Mm-hmm.
Yes.
It goes right here on the inside of your arm. All right.
But it's like
Here's some reactions to medicine. Side effects, reactions to medicine.
I don't need it.
Other than the ones that are intended. So most medicines, when you taking medicine, what most medicines say may cause what?
Suicide thoughts.
Dizziness, drowsiness.
Yeah.
They be having a whole list.
That's a
more
side
than they're
effect.
reading.
Heart attack, vomiting, nausea, all kind of stuff.
Blurry vision.
Because if you blurry vision, if you don't take it as intended or instructed, it may cause those things. Now, interaction, additive interactions. Medicines work together in a positive way. So, is it a good idea to take your medicine with alcohol?
No.
It depends on what's on the bottle.
Depends on what it says on the bottle.
It's like certain ones you can't
When
mix.
I take with alcohol.
I probably wouldn't take any of them with alcohol.
Right.
Just in case.
You know, but
What if that's the
I've
only thing
known-
I can drink from?
I've known some people that take it with alcohol and
Did no effects happen?
no effects. They be fine.
I thought it was like with certain ones, like
Yeah.
certain medicines and certain alcohols. If you mix them, it's like that.
Yeah.
Like that.
I would think like it would be bad to mix your
I would definitely say it wouldn't be the smartest thing to
right. I would
Do
mix it with alcohol. Most medicines you should take with food
or wine.
as instructed. So most medicines they offer to take how many every so often. Maybe one. It's probably one tablet every 6 to 8 hours.
There's some like some cold medicines. It's like one pill every 4 hours because
Mhm.
it's like something.
So it's definitely a good thing to do that. All right. What is a tolerance?
Oh what?
Tolerance.
Oh, like you have a tolerance to medicine.
Like,
Like-
something you can.
Yeah, if you take it for so long, your body gets used to it, so you have a tolerance to that medicine.
It's kind of like becoming immune to something. So tolerance, the body becomes used to the effects of the medicine. The body requires increasing large doses to produce the desired effect. So, can you build up a tolerance to Tylenol?
Yeah. If you take it too much, like every day, you take some.
Like sometimes, like that'll be your like since you took it so much, that'll be like your first result when you start hurting. Like, I need some Tylenol.
You know. What about withdrawals?
Oh my gosh, that when somebody like stop using something
Mhm.
and then they start just.
Most people that have withdrawals, they go through like sweats. They go through like jitters, shakes, all those different things. All right, so say withdrawal. A person stopped using the medicine on which he or she has become physiological dependent on. Symptoms: severe headaches, vomiting, chills, and cramps. I've actually been that way before. I was taking some medicine for my diabetes, and I was like, well, let me stop taking it and see how I feel. I'm a type 2 diabetic, so I'm not insulin dependent. My body still makes enough insulin to keep my numbers where they need to be. But I was like, one day I was just sitting there, and like my wife was like, are you hot? I'm like, no. Like I'm talking about I was just pouring out, sweating, like, and then I started getting cold. So I'm like, at this point, I'm like, COVID just came out, man. I know I ain't got COVID because I hadn't been around anybody. So it was actually signs of me going through withdrawals from not taking the medicine anymore. So withdrawals, most people you see, and withdrawals with are like drug addicts or alcoholics, and they go to just say recovery, and they go to their little halfway houses and they go through withdrawals. So they have to strip them clean of the drugs. What about medicine misuse?
Like if you don't.
Is it common?
Yes.
Yes.
It is. All right, so medicine misuse, using medicines in ways other than intended to use. Fail to follow instructions. So if the pill say take one every 6 to 8 hours and you take two every 6 to 8 hours, I'm misusing it. And I was guilty of it. So I had surgery one time. I had my knee worked on. And so the doctor was like, you take one every 6 to 8 hours. I'm like, well, doc, I'm a larger man. He said, man, these pills strong enough. So I thought I was a doctor. And guess what? I ended up taking too much of the medicine. And so I was like feeling like real off. I'm like, man, why I feel like I'm floating and all this? Like, I overdosed on the medicine because I wanted to do what I wanted to do and not follow the instructions of the doctor who went to school for several years to prescribe all these medicines. All right? Give a prescribed medicine to the person for whom it is not prescribed for. So how many times have y'all had, like, I know it's not a lot of y'all that would say, hey, I gave my sister this medicine. She take ADHD medicine. I take ADHD medicine. She ran out, so I'm going to let her get one of my pills until we can get her medicine. Does that happen?
Yes.
It happens a lot. Well, hey, my friend, she just had surgery, and I got some leftover Percocets, but she needs some because her doctor ain't give her a strong enough medicine. She said the Tylenol 800 ain't strong enough, and she came by my house to get it. That's misuse of medication, right? All right, taking too much or too little. Like I said, I've experienced taking too much. All right, taking the medicine longer than or shorter than the prescribed. So you say, think about it, you go to the doctor, you get a Z-Pack. They tell you, hey man, you gotta take 6 pills for 3 days, 4 pills for 2 days, 8, and then you go 6 days at 1 pill a day. But guess what? You say, hey, I'm gonna take 7 pills today so I can cut a day short on my 1 day pill. It happens like that. All right. Discontinue the use of medicine without informing your healthcare provider. That happens a lot. Mixing medicines with the knowledge of healthcare provider. I don't think this one happened a lot, but I'll just tell you. Taking medicine, like giving somebody the medicine that is not prescribed for, it happens a lot. It happens a lot. Medicine abuse. The intentional taking of medicine for non-medical reasons. Some teens feel that since a medicine is a prescription or over the counter, that it is safer than an illegal drug. So is prescribed medicine or over the counter medicines safer than taking, just say, heroin? Because guess what? You still can abuse that just as you abuse heroin. It's still abuse. And then abusing the medicine is dangerous or illegal. Is it dangerous or illegal?
Both.
Both. All right. Teens should avoid using drugs to lose weight or stay awake while studying. This happens a lot. ADHD medicine, they use that during finals. A lot of college students, they get the ADHD medicine just to stay up so they can be focused for several hours. All right, to fit in with peers. How many times y'all fall victim to peer pressure? A lot. I'm not saying you all in general, but I'm just talking about teens and other students around. Avoid taking medicine that was prescribed to someone else. This is illegal and unsafe. So that happens a lot also. Prescription drugs. So we got a little clip that show like prescription drugs and all that stuff.